Hey you guys, thank you so much for tuning into my channel. My name is Ashley, and today I will be talking about my first year as a registered nurse.
Is it too late now to say sorry? 'Cause I'm missing more than just your body. Oh, is it too late now to say sorry? Yeah, I know that I let you down.
So again, hi, my name's Ashley. I'm a registered nurse. I actually celebrated my nurse anniversary on this past Wednesday, July 6th. So I've been a nurse for 1 year. Yes, I'm so happy. I just look back at the past year and like, wow, like a year, like the year went by so quick, like, oh my god. But I graduated nursing school in May 2015. I graduated from the University of Tennessee at Knoxville. I took my NCLEX around June 30th of 2015. I passed and I started my job July 6, 2015 as a mother-baby registered nurse. So for those of you that don't know what a mother-baby nurse is, a mother-baby nurse, I take care of moms and babies about 2 hours after they deliver, whether it's a C-section or a vaginal delivery. So I'm taking care of both mom and baby. We call them couplets. So a couplet is a mom and baby. So I can be doing anything from, having to give a baby a bath, of course doing vital signs on moms and babies, making sure the moms have their pain medicine, performing assessments on moms and babies. Then in regards to, I would say mother baby is very more so about a lot of education, whether it's breastfeeding, how to change your baby's diaper, or just anything like that. I feel like my job, I'm educating moms a lot, with safe sleeping. I love my job. I can say this, like, I always knew that I didn't want to do med-surg straight out of nursing school. And that's always something I tell, whenever I have nursing students or just people who are interested in nursing in general, you don't always have to do med-surg once you get out of school. If you know you want to do NICU, I would go for NICU. If you want to do peds, if you want to do ER, or if you want to do something else other than med-surg, I would always try to go for that. Because, some jobs you don't have to have like 1 year med-surg experience. Some jobs will just take you into the specialty immediately. And that's what my job did. Because, I know I've always wanted, well, I didn't know about mother-baby nursing until I got into nursing school. Like, I always knew about labor and delivery nursing, but when I got into nursing school, they was like, oh, it's mother-baby, when the baby is born, mom doesn't stay in labor and delivery the whole time. She has to go to like the mother-baby floor. Now, I am aware that some hospitals, they have everything in one room, like you do labor and delivery, your recovery, postpartum. Some hospitals do that. So yeah, I always thought labor and delivery was one thing, but then when I was in nursing school, it was mother-baby, and mother-baby, it fits my personality. I'm very calm, chill, very laid back. I love my moms and babies. I get just joy from teaching a dad how to change his baby's diapers, or, helping a mom, feed her baby and things like that, So I love what I do. If I could describe, if there was one word to describe my journey, my first year as a registered nurse, I would say growth. I have grown so much as a registered nurse in my first year. Like, it's just mind-blowing to me. Like, I can remember, for instance, in nursing school, how I would be so afraid of IV pumps, you know, hanging bags of fluids or whatever. But now, you know, it's nothing to me to go in there and like put a bag of fluid up or have to administer medication via IV, or, you know, giving a baby antibiotics, you know. And I was just like, wow, you know, I used to be so afraid of IV pumps in nursing school, but now that I'm a nurse, you know, I realize that it's nothing to it. And I can say, in my opinion, I feel like nursing school gives you like a basic foundation of nursing, but I would say everything that I know about being a mother baby nurse, I've learned on my job, definitely through my preceptors or other nurses. And, you know, I do use that knowledge that I did gain from my mother baby course, but in nursing school, but for the most part, I've learned everything about being a mother baby nurse from my job. I have 5 tips for new grad nurses. So my first tip would be to always ask questions. Always, always, always ask questions, because you're not going to know everything, and that's okay. I remember going on job interviews, you know, my last semester in nursing school, and one of the nurse managers was telling me that it's very concerning to her when a new grad nurse doesn't ask questions, because sometimes those are the ones that can make, you know, serious mistakes. So I would say always, always ask questions, no matter how big the question is, how small. Never think that your questions are stupid, because think about this: if you don't ask a question and it harms the patient, so always, always, always ask questions. And I would say this for the new grad nurses, you know, once you get out of orientation and you're on your own taking care of patients, I think it's a great idea to make your schedule like your preceptor schedule. So that way, on the days you work, you know that you have a person that you can trust to go to if you have any type of questions. And I know on my unit, all the nurses are very helpful. You know, they know that I've only been doing this a year. So, you know, they know I'm going to have questions. And I'm very happy, you know, that I can go to people if I have questions about something. My second piece of advice is to speak up. Whether it's for yourself or for your patients, you have to speak up. That is something that I learned to do with my job. Because, you know, in regards to speaking up for my patients, you know, if I think that something is wrong with either a baby or mom, and, you know, the doctor isn't taking my concerns seriously, you know, sometimes you have to go up that chain of command. And I say, you know, you should familiarize yourself with, you know, the chain of command in your hospital. But always, always, always speak up for your patients. If sometimes you just have a gut feeling that something is different about your patient. And I've read many stories about how that gut feeling that nurses get about their patients ends up saving their patient's life. So always speak up for your patients. And speaking up for yourself is very important. Some doctors may talk rude to you. You may have other nurses who are rude to you or try to run over you. And sometimes you have to speak up for yourself in a respectful way, of course. And, you know, you have to show that, you know, hey, you're not going to run over me, you know. I'm your colleague. We're equal, you know. Please talk to me with respect, because I'm talking to you with respect. And, you know, you're not going to tolerate anything. And you're not going to tolerate disrespect. So definitely speak up for your patients, and ultimately you have to speak up for yourself. My third piece of advice is always make sure that you wear compression socks and comfortable shoes, because you could be on your feet all day. You don't know what you're going to walk into when you go to work. So always, always, always wear compression socks, because they help prevent varicose veins you know, fatigue. And you can get compression socks, I think, from anywhere. I always go to our little nurse, whatever you want to call it, nurse store, nurse uniform store here that sells like scrubs and everything, and they have compression socks. And in regards to comfortable shoes, I wear Skechers with memory foam, and I'll insert a picture of my shoes. I remember in middle school I would not touch Skechers, but now, honey, yes, give me a pair of Skechers to wear to work. And they're so comfortable with the memory foam, and I know that they have, I've heard of this brand called Danskos. Those are those like thick black shoes. I heard those are good, but you just have to break them in. But I'm more of a tennis shoe type of girl, so I definitely would recommend Skechers with memory foam if anybody is looking for them. I got mine from Shoe Carnival, and you know, at Shoe Carnival you can always do the buy one get one half off, so you get 2 pairs of shoes. My fourth piece of advice is to always have a pair of extra scrubs in your locker. You don't know whether you're gonna get poop on you, pee, vomit, blood. You don't know. So, and who wants to stay in dirty scrubs all day? So always make sure you have a pair of extra scrubs in your locker. They have saved me a time or two. You know, whenever a baby boy decides he wants to pee on me, having extra scrubs is smart. And my last piece of advice, be happy with whatever you choose to do. For my Med-Surg 2 clinicals, my clinical instructor told us, you know, there are 104 specialties in nursing. You know, you have to find what fits you. There are so many opportunities in nursing. And you know, if you go on the Johnson & Johnson website, I'll link it down below. You know, they have all the specialties of nursing that you can go in, and like the degree requirements. So some require a course of BSN, some require MSN, some require PhD, some require doctorate. But there are 104 specialties in nursing. So, you know, you have to find what fits you and your personality. I believe that there is a good fit for everybody in nursing. You know, some people like changing up specialties and learning new things, but me, if I find something I like, I'ma stick with it. Like, that's the person that I am. So, you know, I really started my YouTube channel to help nursing students and other nurses. So, you know, if you have a question about anything, you want to be a mother baby nurse or anything, please just leave me comments. I love when you guys leave me comments so I can connect with you guys. You know, you can follow me on Twitter or Instagram. You know, just let me know what type of nursing videos you want to see, whether it's in regards to nursing school. Some different things. Of course, I want to film a video. I'm definitely going to film a video about my NCLEX experience and what I used to pass on the first try. I definitely want to start a series on my channel where I like interview nurses from different specialties, just so you guys can see, you know, what it's like to be a cardiac nurse, or what it's like to be a NICU nurse, you know, what it's like to be an ICU nurse. I definitely want to start that on my channel, because I know I have friends who work in different specialties of nursing. Thank you for watching my channel. Please stay tuned. Please like, subscribe, comment. Thank you.